You good? Good morning, everyone. I am KP Georgia, Fort Bend County Judge. I am joined by a number of important people from the county and also from our community today. I'd like to recognize, of course, Fort Bend County Sheriff Eric Fagan, and of course, the first. How do you? I still cannot get it right. First assistant or the chief deputy? Chief deputy. I will get it one day, sir, and also Chief Zamora and our behavioral health director, Dr. Connie Almeida, and also Dr. Gearing from the University of Houston. The social work department. Last Tuesday, as you all know, that Commissioner's Court accepted a grant fund from Department of Justice for program. The program is called the Second Chance Act, addressing the need of incarcerated parents and their minor children. And I was just reading this morning, and I was just thinking many times, everybody's not thinking about what happened to those children, incarcerated children. And I was thinking about it. I don't think about it all the time. And so this is so important when you think about the numbers of how many incarcerated parents, children live in our community and in our country, in our state. The grant amount is $740,000 with no match required from the county. These funds will allow behavioral health science, and also Fort Bend County Sheriff Department to give an opportunity to collaborate in this program. The program is called Always Parenting Program. And more than 5 million children in the United States have experienced the incarceration of their parents sometime in their life. And of course, our state, 500,000 children are out there in our state from incarcerated parents. It is important for us, a community and a government, speak up for these children. Otherwise, nobody will be speaking. Separated from their parents by incarcerated, and advocate for programs much like the one we are announcing here today. Once again, Always Parenting Program, and announcing here today, and also make easier for kids to visit their parents while they are in prison. Research has shown that visit help both ways. Actually, it reduces the misconduct and also returning to prison when it comes to the parents, and also suggests it positively affects the children and their well-being and improve the chances that family will remain intact when the former inmate re-enter into the community. At this time, I will ask Dr. Connie Almeida from Fort Bend County Behavioral Health Department to come and explain about this program, and later I will invite Sheriff Fagan and his team to talk about their role in it. That's now Dr. Connie Almeida.
Thank you, Judge. I'm really delighted to be here and talk a little bit about the Always Parenting Program. This is something that we've been working collaboratively with the Sheriff's Office and several of our partners for over 2 years. As the judge said, these children are often forgotten. We know that there are many children in our country, in our county, that are impacted adversely by the incarceration of their parent. We also know that children, African American children, are disproportionately impacted. There is some research that says 1 in 9 children, African American children, have a parent that's incarcerated at some point in their lives. So we know that's a risk factor, and that's a risk factor for a variety of things, including their own further involvement in the criminal justice system. So in Fort Bend County, as we work to break this cycle of cradle to prison, this intergenerational cycle of criminal justice involvement, child abuse, it's really important to start early. And that's what we're doing here. This is only one of the many initiatives in Fort Bend County to support our children. Some of you have heard about our Expose Excellence in Youth program. And so that's really what we're doing, working with our partners, working with our communities. But this is an amazing, unique opportunity. In Fort Bend County, we've done a lot of research and let me correct that. We've done a lot of work, hope to do more research on parent-child interventions. For example, we use trust-based relational interventions to heal the parent-child relationship of children that are in the child welfare system. So that's some of the work that we're doing that we hope to expand upon. How do we work with the parents that are in our jail, help heal that relationship, continue that work when they get out, and support the families, try to mitigate some of the adversity that's associated with the incarceration, not only the trauma, but also the financial stressors, the displacement from homes, the educational difficulties, and then again, of course, the trauma of having a parent that's incarcerated. This is a 3-year grant. We are extremely excited about it. It has several components, including, again, working with the sheriff's office, coming up with developing a visitation program within the sheriff's office, and identifying individuals that have children that we can work with, and then looking at what are those needs of those children, and then again, working together to mitigate those needs and to help heal that relationship. We know that can make a difference. Again, those kids are very much at risk, but we know that by building on those protective factors, like the positive relationship and that connection with the parent, and then also mitigating some of that adversity that's associated with the incarceration, we can change the outcomes for these children. So I'm delighted to have this amazing partnership, and we can't do any of this work alone. This is an exciting opportunity for Fort Bend County. Thank you.
Thank you, Dr.
Sure.
Thank you, Dr. Almeida. And obviously, you all know that we have numerous uniformed people next to me, important people, because when it comes to incarcerated, when it comes to jail, when it comes to law enforcement, they are the supreme authority in Fort Bend County, and they are in charge of these things because their participation in this discussion is so important. And you see that by number of people here, you see that their participation, and they are absolutely on board. And I'm so excited to see that Fort Bend County Sheriff Department is excited and engaging with this program, Always Parenting program. I will invite our Fort Bend County Sheriff, Honorable Eric Fagan, to talk about this program. Sure.
Thank you. I'm Eric Fagan, Fort Bend County Sheriff. Incarcerated parents place a significant stress on families. Incarcerated parents of children, these children are more likely to have behavioral problems, sometimes association with other children, and they have a psychological problem more often than other children who don't have incarcerated parents. This program, this grant, gives us the opportunity to address this issue, where the kids can come safely and to sit down and to talk with that incarcerated parent, to take some of that stress off these families. This is a great program, a program where law enforcement is reaching out to entities like in the psychological areas, Dr. Almeida, where we're working hand in hand to address this issue, because she's right. Crib to prison cycle has to be broken. And then we can only do that if we start working together. And this grant allows us to do this. So I want to thank Dr. Almeida and the doctor from U of H for putting this grant together, because we sometimes don't have the funds to do this, and so they have to go out to get these grants, and these grants can actually save lives. So again, I want to say thank you to everyone for putting on this initiative.
Thank you, Sheriff. Absolutely. And as you all know, Sheriff Fagan and his team is doing a lot of different things in Fort Bend County. It's never happened before to make our citizens' life better. And I'm so thankful to work with Sheriff Fagan and his team. At this time, I will invite Dr. Gearing from University of Houston. Please come up, sir.
Thank you, Judge, Sheriff, Dr. Almeida. I'm Robin Gearing, Dr. Robin Gearing at the University of Houston, Graduate College of Social Work. We've had the ability to do a lot of collaborative work with Fort Bend County and with Dr. Almeida and her group of Behavioral Health Services. No child asks for the parents to be arrested and put in jail and taken away from them. Not one. It affects their adverse events as a child, increases 300%. Their trauma experience increases significantly. This affects pro-social behavior, criminology, pro-social school behavior, overall functioning, academic behavior, their ability to earn incomes in the future, and be productive and constructive members across society. But this issue doesn't affect everyone equally. 1 in 9 children who are African American will experience a parent who is incarcerated. 1 in 27 Hispanic children compared to 1 in 57 white children. So for a community that is as diverse as Fort Bend County to take on this issue, which is significant and very challenging, is a great honor for us at the university to work with such committed and dedicated individuals to say, this is our issue, this is our concern, and these are our citizens. So it's a privilege to be part of this organization. I just thank everybody in Fort Bend County and all the efforts you guys have been doing for the years that I've been connected. So thank you.
Thank you. Thank you, Dr. Gearing. And obviously, this is actually shedding light on this issue more than ever before. And you heard about disproportionately affecting, people especially children of color. And that is, they are our children. They are our children, whether we like it or not, they exist. And it is taking care of them is the most important thing. And when parents are incarcerated, definitely you heard from many experts here, children suffer. By offering a program which allow parents the chance to serve their sentence and still spending time with their children to help maintain that family structure or stability. The children have done nothing wrong. You heard that from different people mentioning here before. And where we can help, we should. And thank you, Dr. Almeida, Sheriff Fagan and his team, and also Dr. Gearing for being here and putting together this program. And as I mentioned always, they all are our children, and I'm so excited to be part of it. If anything I can do to support and help this effort, you know that I'm only a phone call away, and so our office is only a phone call away. And I'm so excited to see that we are doing something about mostly forgotten, many times forgotten, and often maybe even fall through the crack, our children. And finally, we are doing something in Fort Bend County, and we will continue. This is how we make a difference in our citizens' life. We are always committed to do that. And so that will conclude this press conference. If you have any question, we will entertain at this point.
Any questions?
Good.
How many children in the country will benefit from this program?
I think Dr. Almeida or Sheriff Fagan,
Yeah.
how many children in our county identified?
How many children are identified?
Yeah.
We have some.
For Bend County.
Right. We have some preliminary data from that we looked at in 2019. So one of the first steps is to develop a system that tracks this information. This is not something that's typically tracked. So because actually we have a great relationship with the Sheriff's Office, we were able to pull some preliminary data. Because again, it's not something that's tracked. So part of it is we want to identify that. We want to start asking, how many children do you have? What are their ages? Where do they live? So in our preliminary data, and this was from 2019, I'm trying to remember, I believe we had 54% had children that were minors. Let me pull those numbers out. Yes, so 44%, but we had some missing data. So we had about 5,000 individuals that had children that were minors, that were in the jail in 2019. 26% of those were mothers. Then we had some information, again, very unique for a jail to track, like their marital status, single parents, large percentage of single parents. But just even based on that preliminary data, we found that about 13,000 of those children, so the total impact was 13,000 children that in Fort Bend County, again, preliminary, some missing data, but just really rough, 13,000 children, minor children in Fort Bend County were being impacted by the incarceration of their parent. But we will continue to look at that data, and that will be our first step, is really to identify those children, look at the ages. Very important, we see a lot of the children are under the age of 5. So again, because of our work around early development, if we can really support that bond relationship at that time, very critical.
Honestly, I'm sorry to hear that we don't have any data. Previously, we never tracked. But thank God for Sheriff Fagan and his team. Thank God for Dr. Almeida. So we are moving in the right direction. These children are never going to be forgotten, and we are going to be doing something about it. That's why this press conference and this grant is so important. In this process, we are going to make Fort Bend County a better place for us, our children, and generations to come. Thank you.